Hey everyone, and welcome to this explainer. I am so glad you're tuning in today because, well, we're going to take a really close look at a medical reality that affects just a massive number of people, yet it kind of flies totally under the radar until it's already causing some pretty major problems. We're going to unpack the science and the daily realities of diabetic neuropathy. Now, I want to set the right tone here from the get-go. Yes, this is an urgent health topic, one we absolutely need to respect, but the good news? It is also highly manageable once you actually understand what's happening inside your body. By breaking down the data today, we're basically going to take this silent threat and turn it into something you can actively monitor and control.
Okay, let's dive into this, and I actually just want to pause for a second to let that question really sink in. Did you know that diabetes can damage the nerves in your feet before you even notice it? It's kind of sobering, right? I mean, we usually rely on our bodies to scream at us with loud signals when something is wrong. But the medical reality here is this specific type of nerve damage, it doesn't always announce itself right away. It's just working quietly in the background. The damage is happening, the nerves are literally degrading, but your conscious awareness of it might be lagging way behind. And that scary gap between the hidden reality of the condition and your actual perception of it, well, that is exactly why we need to understand how this all works.
Section 1. The silent nerve damage.
And this brilliantly illustrates what we're actually dealing with. Fundamentally, diabetic neuropathy is a specific type of nerve damage. But consider the cause here. It's driven by high blood sugar over a long period of time. This isn't just something that pops up overnight. When your blood sugar stays elevated, it slowly, methodically eats away at those delicate nerve fibers. And the absolute crucial detail to highlight is the location. The earliest symptoms almost always start way down in your extremities, specifically the feet. Why? Well, because those nerves are the longest ones in your body. They run all the way from your spine down to your toes, making them incredibly vulnerable. They're usually the very first to show the wear and tear of that long-term glucose exposure.
Section 2. Spotting the early signs.
So let's walk through these early warning signs pretty carefully because, honestly, recognizing them early is your absolute best line of defense. First, you might start noticing a weird tingling sensation. You know that feeling when your foot falls asleep? It's like that, except it just doesn't quite wake up. Then there's this burning feeling, which, as you can imagine, is highly uncomfortable and disruptive, especially when you're just trying to rest at night. You might also get some numbness, just a dulling of your normal sense of touch, or, on the flip side, sudden, incredibly sharp pain. I really want to emphasize these specific symptoms because painting a vivid mental picture of what this actually feels like helps us stay vigilant. These aren't just your standard everyday aches and pains. These are literally the distinct electrical misfires of damaged nerves crying out for help.
Now, what's really interesting about this slide is this incredibly specific and honestly kind of surprising sensory detail that a lot of patients report. It's a feeling of wearing invisible socks. Just imagine that for a second. You are completely barefoot, right? But your brain is genuinely processing the distinct, constricting, fabric-like sensation of wearing socks. It's wild. This happens because the sensory feedback loop running from your feet up to your brain is getting completely scrambled by the neuropathy. It's a fascinating but obviously troubling hallmark of the condition that perfectly shows how nerve damage can completely trick our own perception.
And that brings us to a really critical contrast. On one side, we have feeling pain. Now, nobody likes pain, but it's actually our body's normal, healthy warning system. If you step on a sharp piece of glass, pain screams at you to move your foot and take care of the cut. But on the other side, as the neuropathy gets worse, some people completely lose sensation. They go totally numb. And here's why that complete numbness is actually way more dangerous than sharp pain. If your body's alarm system is literally disconnected, you can so easily miss cuts or blisters or even serious developing infections. A tiny pebble in your shoe that you simply can't feel can create a nasty wound that goes entirely unnoticed for days, and that leads to severe complications.
Section 3. The daily foot check.
Let's move to and see how this builds into an actual daily routine. Because you might not be able to feel an injury down there, you literally have to use your eyes to do the job your nerves used to do. That is exactly why checking your feet every single day is absolutely crucial. Step 1. You're actively scanning for any unexplained redness, which is a major primary indicator of irritation or infection. Step 2. Look for swelling, which tells you some sort of trauma might have happened. Step 3. Meticulously check for any open wounds, blisters, or cuts. And Step 4. Just notice any overall changes in your skin and nails. Seriously, this quick visual inspection takes what, maybe 2 minutes? But it completely bypasses those broken nerve pathways to keep you safe.
Section 4. Protecting your nerves.
Okay, here is the incredibly empowering news. You actually have a fantastic, proactive arsenal at your disposal. The absolute best way to slow down or even prevent diabetic neuropathy is by going straight after the root cause, keeping your blood sugar under really good control. So how do we pull that off? It's a holistic approach. Healthy eating provides your body with the right fuel without causing those massive glucose spikes. Regular exercise gets your cells using that blood sugar way more effectively. Taking your medications exactly as prescribed. That ensures your body gets the chemical support it needs. And actively monitoring your glucose levels keeps you completely informed so you can make necessary adjustments. Put all of that together, and you've basically built a shield that actively helps protect your nerves from taking any more damage.
Section 5. Taking early action. Look, if you're experiencing literally any of the symptoms we just mapped out earlier, the tingling, that weird burning, or that invisible sock sensation, please do not brush them off. Talk to your healthcare provider early. I really want to deliver this message with a sense of empathetic urgency. Medical partnerships are absolutely essential here. You do not have to manage this by yourself. And honestly, just hoping the symptoms will eventually fade away, well, that's just not a strategy. The medical data is totally definitive on this point. Getting early treatment can make an incredibly big difference in your long-term mobility and your overall quality of life.
So, the crucial point is this quote right here. Healthy feet start with healthy blood sugar. It all traces back to this one fundamental relationship. You simply cannot separate the health of your extremities from the systemic control of your glucose levels. It's a package deal. And I think this beautifully summarizes the core thesis of our whole explainer today. By actively managing what is happening inside your bloodstream, you are directly preserving the structural integrity and the precious feeling in your feet.
I want to leave you with one final, incredibly practical thought to end our time together today. Have you checked your feet today? It's such a simple little action, but as we've seen through all the data and the science today, it's an action that could literally save you from some pretty terrible unseen complications. So take a quick moment right now, or the second you get home, and just take a look. Be proactive, stay informed, and please remember just how much power you actually have over this silent threat. Thank you so much for joining me for this explainer.